Did you know cataract is the leading cause of blindness in India? But it is completely treatable. Why cataract surgery is important? When should you do it? Don't ignore cataract when it is right time for surgery. Are you seeing blurred vision? Do you like to look too bright at night? Are you postponing cataract surgery because you are afraid? Many people delay cataract surgery for years. But do you know delaying too long can make surgery more difficult? Today let us understand why cataract surgery is important and when is the right time to do it. What exactly is cataract? A cataract is when natural lens of your eye becomes cloudy. Normally the lens is clear and helps focus light on the retina. But due to aging, diabetes, injury or steroid use, the lens slowly becomes opaque. Common symptoms: blurred visions, difficulty readings, colors around the lights, night driving problems, colors looking faded. It usually develops slowly, so many people ignore it. Why should we do cataract surgery? There are no eye drops or any medicines that can remove cataract. The only permanent treatment is surgery. Clear vision restored, improved night visions, better quality life, reduced risk of falls in elderly, better independence. Imagine an elderly person who cannot recognize face clearly. After surgery, the same person can read, walk confidently and enjoy life again. Cataract surgery is one of the safest and most successful surgeries in the world. Why should you do cataract surgery? Very important sections. Earlier doctors used to wait until cataract become mature. But today, that is not necessary. You should consider surgery when vision affect daily activities, difficulty driving at nights, cannot read properly, specs no longer help. Doctor recommends based on examinations. If you delay too long, the cataract becomes very hard. That can make surgery more complicated. Earlier, surgery is often easier and safer. What happens if you delay too much? Increased eye pressure, inflammations, complete vision loss. Hard cataract make surgery more complicated. Many patients wait out of fear, but modern cataract surgery is quick and almost painless. Is cataract surgery safe? Explain modern technique: small incisions, phacoemulsifications, artificial lens implanted, no stitches usually, 10 to 20 minutes procedure, same day discharge. Success rate is very high when done by experienced surgeon. Like any surgery, small risks exist, but serious complications are rare. Who should be extra careful? People with diabetes, high BP, previous eye problems, they should not delay consultations. What are the surgery procedure? First, numbing the eye. Before surgery, doctors put anesthetic eye drops to numb the eye. The patient does not feel pain during the procedure. The eye is cleaned and covered with sterile cloth. Second, small incision in the eye. The surgeon makes a very small cut about 2 to 3 mm at the edge of the cornea. This tiny opening allows surgical instrument to enter the eye. Most modern surgeries are phacoemulsifications. Third, opening the lens capsule. Inside the eye, there is a thin membrane called lens capsule. The surgeon carefully opened the front part of this capsule to reach the cloudy lens. Fourth, breaking the cloudy lens. A small ultrasonic probe is inserted. It uses ultrasound energy to break the cloudy character lens into very tiny fragments. These fragments are then gently removed by suction. Fifth, inserting an artificial lens. After removing the cloudy lens, the surgeon inserts an artificial lens called an intraocular lens. This lens unfolds inside the eye and stays permanently in place. 6. Closing the incision. Because of the incision is very small, usually no stitches are required, but a cut seals naturally. The entire surgery usually takes 10 to 20 minutes. Listen, the surgeon is talking to patients at the time of surgery. Such a big confidence.
इतना छोटा उससे उतने से इसमें आँख के अंदर चला जाता है और ये ऑपरेशन किया है ना इसको फेकोएमुल्सिफिकेशन बोलते हैं। बोले तो लेजर से वो मोतिया आँख के अंदर टुकड़े टुकड़े करके छोटे कर देते हैं और उसके बाद में फिर ये करते हैं। क्या बोल रहे हो आप?
Once breaking the cloudy lens and sucking the fragments, surgeon implanting artificial lens, a folded artificial intraocular lens being inserted into the eye through a small incision, lens unfolding slowly inside the eye capsule, ultra detailed educational medical visualization. Equipment used in cataract surgery and its functions. First, operating microscope provides high magnification and bright light so the surgeon can see the tiny structures of the eye clearly, essentially for performing delicate surgery. Second, Phacoemulsification machine used in modern cataract surgery. Function uses ultrasound energy to break the cloudy cataract lens into tiny pieces. These fragments are then suctioned out of the eye. Third, phaco probe, a very thin instrument connected to the phaco machine. It delivers ultrasound vibration to break the cataract lens. Next, keratome blade, a tiny surgical blade used to create a small incision or tiny cut in the cornea to enter the eye. Capsulorhexis forceps used to create a circular opening in the lens capsule so the cataract lens can be removed. Irrigation and aspiration system maintain the fluid balance inside the eye, helps wash out the broken cataract pieces safely. Intraocular lens injector used to insert an artificial lens called an intraocular lens. Inject the folded artificial lens into the eye through the small incision. The lens then opens and stays in place permanently. Viscoelastic device, a gel-like substance injected into the eye, protect delicate eye tissues and maintain space during surgery. Eye speculum keeps the eyelids open during surgery so the surgeon can operate safely. Last, surgical drapes and sterilization equipment, maintaining sterile environment to prevent infection during the surgery. If you can see clearly, give this video a thumbs up. Remember, your eyes are most precious and beautiful organ of your body. Cataract is not something to fear. It is a natural part of aging, but delaying treatment can reduce your quality of life. If your vision is affecting your daily routine, consult an eye specialist. Clear vision is not a luxury, it is your right.